Hi, I'm Tracy Carrillo. This week in our discussion, we were to choose one of the three principles of either pharmacokinetics, pharmacodynamics, or pharmacogenetics, and relate it back to a patient that we have participated in the care of in the past. I chose a patient from 1996 when I was a nursing student. He was a 21-year-old male that was diagnosed with non-Hodgkin's lymphoma. The lymphoma was affecting the lymph nodes within his chest wall. It was a very large tumor that was also attached to the superior vena cava. This helps explain the aggressive treatment that he received with the chemotherapy regimens. When I arrived at clinicals and discussed with his primary nurse the medications that he was receiving, she explained it as a heavy-duty multiple chemotherapy drug regimen. And we went over some of the side effects and the adverse reactions that could happen. This patient exhibited many of the side effects that we expected to see. He had a change in taste. He had a poor appetite, weight loss, mouth ulcers, hair loss. He was extremely tired all the time. In between his therapies, he would have a week where his white blood cell count would drop and he would have neutropenia. But then he also developed some of the adverse reactions that we were not necessarily expecting to see. He started becoming really short of breath. One day when I arrived at clinicals, he just had a really bad episode of shortness of breath that they were considering intubation. And that's when they found that he went into congestive heart failure that they suspected was from the medications, the chemotherapy. He also later started having liver problems, and he went into renal failure that required emergent hemodialysis. About a week or maybe 2 weeks later, when I returned to clinicals, the primary nurse for this patient came over and told me that the patient had died. I asked the nurse, did he die from the actual adverse reactions he was having from the chemotherapy drugs, or did he die from the non-Hodgkin's lymphoma? And her reply was he ultimately died from the cancer, because without the cancer he would not have been receiving these chemotherapy medications. I never could understand how a otherwise healthy young individual had such poor outcome and such adverse reactions when older patients with multiple medications and multiple medical problems were having much better outcomes, experiencing far fewer side effects, and were not experiencing these adverse reactions that he had experienced. Well, this week, whenever I was going through all of our learning assignments and reading, and I started learning more about pharmacogenetics, I become very excited, because I feel like if we had had the ability, the means to do the genetic and DNA testing on this 21-year-old individual back in 1996, his outcome could have been significantly different. For those of you that are like I was, really had only heard of pharmacogenetics but didn't know what exactly that meant, it refers to the genetic differences in metabolic pathways which can affect an individual's response to drugs both therapeutically and adversely. So I always thought that our genetics was what we was hereditary, from what we received from our mother and our father. And yes, that's part of it, but that's not all of it. There's environmental factors that also affect it. Chemicals that we come in contact with, illnesses, viruses, all of these build up part of our genetic being. And they affect the way the medication acts therapeutically, and it also affects how medications adversely react in our bodies. So by being able to do DNA testing, A physician can give a more personalized care to an individualized care to each patient, and he or she could determine if how the medication was going to work. They would be able to give the correct dosage that made the medication much more effective. They could also give the correct dosage that either eliminated or at least lessened side effects, and most importantly, the safety of doing away with adverse reactions. My information this week, I started out with our learning activities, and it really sparked my interest when I watched the interactive video from Learn Genetics, University of Utah Health Sciences. So this got me digging deeper and reading more on it. In fact, I've done much deeper than I would have thought on this assignment. And I found a lot of good information from Genome to Therapy, Integrating New Technology with Drug Development. It's a book written in 2000 by John Wiley. I look forward to having deeper discussions with you guys during this course, and I'm really excited to learn more about pharmacogenetics. Have a good afternoon.